Hello, good evening. You welcome to News Hour live on GBC News, your news and governance channel. We are also live on GTV and streaming on Facebook at Ghana Broadcasting Corporation. My name is Micheline Taka.
My name is Clara Mlano. The news headline sponsored by Manchi Biscuits, Munch into Happiness.
To help us translate the news into sign language is Robert Frimpong. So we start with the health segment, which is brought to us Kindness Ernest.
While some thousands of recipients await their second jab of the AstraZeneca vaccines, others who are yet to be vaccinated against COVID-19 are in queues at selected centers to receive the Johnson & Johnson single-shot vaccine.
GBC News visited some centers in Accra to assess the vaccination process, which commenced in the early hours of Monday.
Vaccines which have already been deployed. So various hotspots in the Greater Accra region are currently being administered to people who did not receive the AstraZeneca jab. Health officials at the Kolibu police station, a selected center for the process, could not start the vaccination process at the expected time because the digitized data gathering process stalled due to network issues.
My vaccine came around 8. Yes, but we were waiting for the IT guy to start with the entries before I can give the immunization. Yes, so it was around 9 something that he came.
The situation at the J&J vaccination center at the Mamprobi police station was not trouble-free either, as the IT personnel encountered some problems with data collection, and this also held up the whole process.
The only thing that is causing the delay is the information that is going into the system.
After waiting for about 3 hours, some people started exhibiting their frustration.
Now
we are facing a very big challenge on the system because the tablet man is trying his very best to be able to enter. But you could realize, we could see clearly that it's having some challenges and there are not a number of people here.
The scene at the Mamobi Polyclinic was calm as the mobilization team ensured that everyone had the required identification card to go through the process. According to the health personnel in charge of the vaccination process, although there were some network challenges with data gathering, the situation was brought under control because the center has the IT personnel handling data gathering process.
So far, the process is so smooth. The only challenge is the network. That is delaying the data entry. That is the only challenge. But so far, we have received all the needed persons and logistics to make the program very effective.
All persons aged 18 years and above, with the exception of expectant mothers, are eligible for the vaccination in Greater Accra and Greater Kumasi, where the vaccination program will be administered in about 123 centers. For GBC News, Sufri Wadakon reporting.
At 6 centers have been set up for the inoculation. Our regional correspondent Michael Dewano visited some of the centers. As this report.
The dose of the vaccination has rolled out successfully here in the Tema region. And here in Tema, we have Tema South, which is the Tema General Hospital. We have Tema Community 1, which is Community Health Directorate. Then we have the TMA Maternity and Children's Clinic. We also have Manhia. That is Manhiam Polyclinic and Bankuman Chips Compound. And then Tema North, we have Bethel Hospital at the Community 1 Center. The dose, according to the officials, there are 200. And at the Tema General Hospital, there are 3 teams currently operating there. And each center have 150 doses of the Johnson & Johnson. We are very fortunate to have the Metropolitan Health Directorate, Dr. Salikote, here to give us some few explanation with regards to what has been going on and what they are going to do to make sure that everybody here in Tema gets a dose of this Johnson & Johnson.
This morning, we started rolling out the vaccination. People were here very early. We've started, we have enough vaccinators, we have data entry officers, we have enough doses of the vaccine available also for now. So if you look behind us, you see there are different groups, those who are getting vaccinated, those who are having their data entered into the system. At a vaccination, people have to sit for about 10 to 15 minutes to ensure that they are fine before they move off. We are doing all that. So I must say that all in all, it's been successful this morning.
Yeah, so in all, how many doses of Johnson & Johnson have you received, and how are you going to disperse that to the various centers?
All right, so we received about 24,000 doses. Yes, and we are supposed to vaccinate about 23,000 people. So we know that there will be enough for the target population, or the target number that we are supposed to vaccinate. We are very impressed, and we are happy also. Looks like people really now they want to have the vaccines, and they're very interested in it, and we are very happy.
Stanley Diamano is my name. I work with WHO. I have been assigned to support the Tema Metro with a team. This morning, this is the second point I have visited. I was at the General Hospital where I observed two teams. You can see that the crowd is very heavy and people are anxious to take the vaccine. And we are impressed. And we are saying that it should continue as it is. Even though what has come now may not be enough to reach everybody. But we are expecting more vaccines to come in as the days go by. And we are assuring the community that it is free and it is safe.
Originally, when you go to other centers, you enter your data before you take the vaccine. But here, you take the vaccine, then you enter your data, and it's making the process a bit faster here. So I'm sure if other centers can also learn from what this center is doing. And so, reporting from the Tema Metro Health Directorate here in Tema, my name.
In Kumasi, in the Ashanti region, about 11,000 people have been vaccinated with Johnson & Johnson vaccine since the jab was deployed to the region on the 13th of this month. Over 50,000 jabs are to be administered in the region by Friday, the 20th of August 2021. The Ashanti Regional Health Director, Dr. Emmanuel Tinkran, announced this at a news conference.
Johnson vaccination exercise is taking place in the 4 identified hotspots in the Ashanti region by the Ghana Health Service. They are the Kumasi Metro and Oferikrom, Asokwa and Kwadaso municipalities. At a news conference in Kumasi, the Ashanti Regional Health Director, Dr. Emmanuel Tinkran, explained the reason for the selection of the 4 districts in the region as hotspots.
The districts that are doing the vaccination were selected purposely. Because if you look at the trend in Ashanti, that is where we have the hotspots. So though we have cases in other areas, but we believe that when we vaccinate in these hotspots, it will help us to contain the outbreak better.
Dr. Tinkran also gave a situational report on the COVID-19 pandemic in the region.
And our active cases, as of today, is 818 cases. 798 are being managed as a home base. And then we have 20 on admission in our treatment centers. Out of those who are on admission, 12 are severe, 1 is moderate, 3 critical, 4 critical, and then 3 are mild cases.
A senior lecturer at the Department of Social Studies, University of Education, Winneba, Dr. Vincent Ajahili Mensah, says the fight against COVID-19 will require a collective responsibility to be successful. While government strives to get the population vaccinated, the senior lecturer wants the general public to adhere to the protocols to complement government's efforts.
Ghana has done very well in terms of managing the COVID initially. But it seems that now we are losing the fight because we are all becoming a bit, if I choose the word carefully and advisedly, a bit irresponsible in the way we are managing the COVID. We will see that citizens are not following the protocols. We are not wearing the masks. Public gatherings are happening despite the laws that we have passed. The danger is that we are risking the security of this country because the kind of facilities that other nations have and yet have struggled to manage COVID when it overwhelmed them, we do not have a quarter of those facilities, and it will be a disaster if that happens here. But I think that from from the presidency through to all of us, it seems that we are all failing to observe the rules, and that is why we are where we are today. The beaches are supposed to be closed, but people are going. The bars are supposed to be closed, but people are going. And everywhere people pass through Accra in the evening, you see people gathering at some places, having fun and all that.
The health segment was brought to us kindness Ernest Chemist. I'm to take a quick break. I'll be back shortly. Please do stay.